I think we should get started for the sake of time. So thank you all very much for joining us today. So for those of you that do not know me, my name is Maureen Markle-Reed, and I'm a professor in the School of Nursing and the co-lead of the McMaster Collaborative for Health and Aging, along with Dr. Rebecca Ganan, who is also online today. I just wanted to start by giving honor and thanks to the Haudenosaunee and Anishinaabe nations as the traditional inhabitants of the lands where McMaster stands. To say that is to acknowledge a debt to those who were here before us and to recognize our responsibility as guests to respect and honor the intimate relationship Indigenous peoples have to this land. I'd like to welcome everyone to the Collaborative Conversation series at the McMaster Collaborative for Health and Aging, where we bring together researchers and people with lived experiences to share their journeys and lessons learned in patient-oriented research. And we're very pleased today to have Andre Ceranto and Dean Valentine joining us from Casey House, along with our own collaborative member, Dr. Soo Chan Carusone, who we'll hear more about in a few moments, who will be sharing their experience as part of a community-based research team on how they used a multi-layering approach in engaging and empowering people with lived and living experience of HIV and drug use. So today, we will hear from our community experts about how we can contribute to achieving community relevant research built from equal partnerships, exploring both the challenges and successes from a community-based harm reduction study, and to discover how structures, teams, and individuals can all contribute to achieving community relevant research built from equal partnerships. Just a note that while the content of this presentation is not specifically focused on older adults, I think that you will find that the key learnings from this presentation related to issues such as intersectionality, equity, diversity, and inclusion, engagement of vulnerable populations as research partners who contribute their life experience, will be applicable to any population, including older adults. So following this conversation, all of you are invited to join Reflecting Together, an opportunity for us as trainees, collaborative partners, and community members to come together and share your thoughts on the topics discussed. And so this facilitated discussion will occur immediately following the presentation, and it's an opportunity for attendees to continue the conversation and take our combined learnings into action. So we hope you'll be able to stay for this portion of the collaborative conversations that will take place from 1 until 1:30. So before we get started, I would just like to go over a few housekeeping items. So first, the event will be recorded and shared with you following the event. If you do not wish to be on camera, please disable your video. A notice will appear on your screen to alert you when the sessions are being recorded. We ask that you keep yourself on mute unless you are speaking to help keep background noise to a minimum. Questions and conversation are welcome and encouraged at the end of the formal presentation, but please feel free to use the chat function throughout the event to share your questions that we will revisit following our speaker's conversation. Alternatively, you can use the raise hand function during the question and answer period. And you can find that at the bottom right-hand corner of your screen. If you don't see it right away, then just tap more to find the raise hand button. Please note that the live transcription closed captioning button found on the bottom of your screen if you want to turn this feature on. If you can't see this feature right away, you may have to widen your screen. Guests are welcome to stay for Reflecting Together. That will take place from 1 to 1:30. And if you wish to join this portion of the conversation, please feel free to just stay on this existing Zoom link. We are now on Twitter, and you can find us at MAC Collaborative Aging, and you're invited to continue this conversation using #collaborative conversations and tagging us. So we really appreciate your feedback and we'd love to know how we are doing. So following this event, we will share a short survey that will take a few moments to complete. And as we continue to roll out this new series, we really hope to hear from you regarding what worked well and how we can improve for future events. So now I just want to talk a little bit about what is the McMaster Collaborative for Health and Aging, in case you're not familiar with this research unit. So we are a coalition of researchers, trainees, older adults, and caregivers working together to improve the health and well-being of older Canadians by advancing patient-oriented research in aging. At the Collaborative, we have a commitment to center the voices of those with lived experience and meaningfully engage with older adults and caregivers as we bring an aging perspective to health services and policy research, provide researchers and trainees with methods and tools needed to conduct patient-oriented research, and facilitate partnerships and knowledge translation for patient-oriented research. So drilling down to the Collaborative more specifically, our goal is to provide the necessary methodological expertise to researchers and trainees pursuing patient-oriented research with a focus on health and optimizing aging. So the Collaborative works towards achieving these goals by supporting and advancing patient-oriented research, mobilizing knowledge to improve healthcare systems and practices to ultimately improve the health and well-being of older Canadians, and finally, supporting patient-oriented research capacity building and partnerships. I would also at this time like to acknowledge that our funding is provided by the Ontario Explore Support Unit, which is supported by the Canadian Institutes of Health Research in the province of Ontario. And now I'm very, very pleased to introduce our special guests here today and to welcome them. They're going to actually introduce themselves, so I'm just going to introduce their title and they can take it from there. So our first presenter is Andre Ceranto, and he is the Peer Program Manager at Casey House. Our second presenter is Dean Valentine, who is a member of the board at Casey House. And our third presenter is Dr. Soo Chan Carusone, who was the Director of Research at Casey House and is now the Manager of Strategic Initiatives with the McMaster Collaborative for Health and Aging. So with my great pleasure, I'd like to hand it over to Andre, Soo, and Dean. Thank you.
Thank you, and I get the opportunity to start us off, and I'm always amazed in my work with community engagement when I have the opportunity to meet and work with professionals that authentically and enthusiastically embrace the empowerment of others. So Andre Ceranto, Casey House's Peer Program Manager, working with volunteers and peers for those living with and at risk of HIV, does just that. Andre is first-generation immigrant from Brazil and identifies as part of the 2SL LGBTQ plus and HIV communities. Andre is an advocate for the inclusion of voices of people with lived and living experience with HIV and AIDS in matters that both directly and indirectly affect them, by meaningfully engaging and supporting them to participate and contribute. He is focused on initiatives that provide capacity building and knowledge development. He uses his lived experience with HIV/AIDS to encourage collaboration, partnerships in the community with Casey House, and is a true advocate for community research.
So can I just ask people to put themselves on mute? I'm sorry to interrupt.
I'm very honored to have worked alongside Andre and admire his compassion, dedication, and determinated approach to providing capacity building opportunities for peers. He recognizes the vulnerability in others and has a kind, caring, generous spirit that is always supportive. He brings a whole lot of positive humor to our work, and that is infectious. So thank you, Andre. It's been a pleasure to work with you.
Can we just maybe perhaps hold 1 second while we sort this out? Is everybody on mute other than our speakers? Sounds like it's okay now.
Okay, thank you, Dean, for this wonderful introduction. I hope I'll make justice of my introduction to Sue, which, I thought about when we were talking about introducing each other. I thought I'm not going to talk about Sue credentials because, that it's easy to find, it's easy to see anywhere. But what I will say about Sue is that I heard about her work before I started working here at Casey House. And when I start my position here, very soon we connected, because I think she also heard about me before. We very soon connected, and it was Sue was one of the people here who really embraced me and embrace the work that we do in the peer program, and supported me with her experience in all the research that she has done throughout the years about the community to succeed. There's a few people that I consider mentors in my life, and Sue is definitely one of them. I admire Sue very much for her kindness, like the way to me, every time that we are in a room together, we're discussing something, I feel that I'm learning something with her, because she's so she's very humbled. She's very knowledgeable, definitely, about the community and about the work that she does. She's really committed to community engagement and CBR. She is somebody that makes sure that everybody feels included and heard. And she's very, very intelligent, and there's never a comment or a point that Sue makes that it doesn't make sense or it doesn't give you more food for thoughts. So it has been a pleasure working with Sue throughout the years. It's one of the people that I when I heard she was leaving, it really got me, because I was happy that we're gonna still work together for this project. But also I felt that it's somebody that I really admire and I'll be missing to have around to mentor me, and also to continue learning from her skills. Yeah, so that's Sue in my own words.
Oh, thanks, Andre. And I didn't realize how hard this would be, but I think what we wanted to demonstrate by taking a different approach to our introductions was how much this work is built on our relationships and our respect for each other. And it's been just a true joy to work with Dean and Andre. And I have, as you can tell, we're going around the circle here, the great honor of introducing Dean Valentine. And, it's been such a pleasure to work with Dean. I was first introduced to him by a friend of mine who is a social worker who specializes in addiction care, who'd worked with Dean in a community reinforcement approach addictions program at St. Michael's Hospital, where Dean had worked as a peer facilitator. And at that time, he had just been elected to the board of directors at Casey House. And at that time, he was the only board member who was open about living with HIV. And at that time, he was the only one open about having lived experience with addiction. And to be honest, Kat, who is the other co-lead on this project, and I, we're quite nervous about reaching out to Dean. And it can be a real delicate balance to approach someone because of their very personal experience and experiences that they may not have shared, and in this case had not shared directly with me. And we were approaching Dean and asking him to bring that experience and his expertise to the table in a very public way. And that's a big ask, and it's a really important one, but one I think we must not underestimate. So I'm so thankful that Dean was very kind and open in his response to our invitation and ask of him. And he was willing to start that conversation, which led to a relationship and to our wonderful time working together on this project. And that's something we're both very passionate about. And I can't thank and acknowledge more sincerely all that Dean puts into his work, and he brings his heart and his soul. We've shared tears in our meetings together, and his ability and way of sharing his vulnerability just warms and welcomes people, and it creates that safe, brave and supportive space for other people to be able to share. And he's a strong advocate for including and respecting and empowering those with lived experience, and for providing all the supports that are necessary for making that impactful. And so he brought many hats to this team, and he's had a valuable impact with each and every one of those. So although in today's conversation, we're primarily speaking about lived experience, meaning lived experience with HIV and lived or living experience of drug use, Dean is also a volunteer, a decision maker, and a donor for HIV and harm reduction services. And it's just my great honor and pleasure to introduce Dean and have him join in this conversation. So Dean, Andre, and I are going to share some of our experiences together on a community-based project. And while the project, as Maureen said, is not focused on aging specifically, although we had adults of all ages involved, I believe in terms of community engagement and working with people with lived experience, there's so much to learn from each other across disciplines, across areas of focus, so that we can advance the science of engagement, so that we can do research that strives for health equity and is built on equal partnerships. So even if this project is not in content area of interest for you, I hope you enjoy learning from the experiences of Dean and Andre. And while they start with a few background slides about the specific project that we work together on, the focus of our time will really be in conversation with Dean and Andre. So the title of our project was Engaging People with HIV/AIDS Who Use Drugs and Other Stakeholders in Community-Based Knowledge Generation to Guide Harm Reduction Service Design and Delivery. So as you can tell, we tried to fit everything into that grant title. And then of course it becomes so cumbersome, we can't actually use it. So we refer to the project as the Engage with Harm Reduction Study. And so I have this slide up here just because I want to start by acknowledging the long list of team members that we had involved, and more importantly, to highlight the diversity of roles and stakeholders that are included here. So we have not just academic researchers, but frontline providers from nursing, social work, harm reduction workers, peer workers. We have community advocates, community members with lived experience, and healthcare administrators. So first of all, I just wanted to start with what is harm reduction, or more specifically, how are we using that term here? So harm reduction can refer to strategies that reduce but don't eliminate risks or harms, such as wearing a seatbelt. But in this case, we are referring specifically to policies, programs, and practices that aim to minimize the negative impacts of drug use. And fundamental to this is a focus on working with people without judgment and without requiring that they stop using drugs. So the title of our conversation today started with "Nothing About Us Without Us." And I'm just going to turn it quickly over to Andre first to explain why he suggested this for our title.
So nothing about us without us. It seems, I think, something that, you know, it's a given when you're working with certain populations, but actually at times it's not. And the reason why I decided to add this on the top of the presentation is because this phrase, which has a very deep meaning, has something that has been a part of the drug use community or the substance use or harm reduction communities for a very, very long time, because at some point they demanded, when people were, you know, studying the effects of drugs or and in many other things about the population, they demanded that they be heard as well. They not only be subject of studies or the information, but actually be part of the solution, or be engaged at the table and providing their knowledge and their expertise to be able to guide the work that was going to be done with their population, with their communities, instead of being treated only as patients or subjects of research. They wanted to have, you know, a voice in the decisions and policies that were being developed or created that would affect them directly. And I think this has a very close, or actually walk hand in hand with a very similar philosophy within the HIV and AIDS community, which is the greater involvement or meaningful engagement of people living with HIV and AIDS, which the premise is exactly the same idea, where folks living with HIV, they were tired of being subjects of studies or drug testing and a bunch of different things, and they were not being consulted about decisions that were being made that would impact directly their health. So, so JIPA-MIPA, much like Nothing About Us Without Us, you know, shift the paradigm of how to engage those folks and remind people that those that are being directly affected want to be in the table, want to participate, want to have their voices heard, and as many say, they want to be seen as part of the solution and not part of the problem. And I think at the end of the day, folks that belongs to those communities, they are the expert. They have the expertise. They have all the knowledge, and it's about only engaging with them to be able to tackle those and make a good use of those resources.
Thanks. Sorry, thanks, Andre. So this project was funded by the Ontario HIV Treatment Network under their community-based project and participatory evaluation awards fund. And I bring this up because I want to acknowledge the power of funding bodies and the associated structures in shaping not just what research gets done, but also how it gets done. And for this grant, they actually require that the nominated principal applicant be based in the community at a community-based service organization. And that in the grant, you're required to demonstrate how the question was identified and demonstrate throughout that it will be addressed through a meaningful partnership with community members and organizations with the support of researchers. So I've been fortunate enough to get funding for a number of grants through this stream, and they actually go through a process of working with the applicants. They often require changes to be made before they secure funding. And those have in the past been requests that a person with lived experience be added on the principal leadership team. In this case, we went in first try with that with Andre on our team, but they did come back and ask us to demonstrate how will we be reaching people who are most impacted by drug use, who most need harm reduction services, and how are we going to work with them through our analysis, through our knowledge translation at the end of that. So in the case of this project, the funds came to Casey House, and we had a 3-person principal investigator team. So myself, a postdoc, Catherine Rodzinski from the University of Toronto at the time, and Andre. And for those who have not heard about Casey House opened as an AIDS hospice in 1988. So at the height of the AIDS epidemic, where fear and stigma were rampant, not just in the community, but in the healthcare system. And as our understanding the people affected and the treatment options evolved, so did Casey House. And in 2016, it officially changed its status to a hospital. It expanded its services in 2017 to include a day health program. And in 2021, partway through this project, it opened its first supervised consumption services in the inpatient program. And I mention this because this expansion of services was impacted by research partnerships, by community engagement, and the work that happened over the preceding 10 years. And so this project is just one piece of a much bigger initiative and activities at Casey House. So here's a picture of the supervised consumption services at Casey House. And so supervised consumption services are an example of harm reduction services, and they provide safe, clean space for people to bring their own drugs to use in the presence of trained staff. And so there's strong evidence that these services can prevent accidental overdoses, reduce the spread of infectious diseases, and offer an access point for health and social services. And so the link at the bottom here is from Health Canada, and it provides some interesting facts and kind of FAQ for those that are interested and might not know a lot about supervised consumption services. So before this project, many members of the team were involved in a community-based research study that evaluated the feasibility and acceptability of supervised consumption services at Casey House. And so that work was an important precursor for the hospital's board and leadership to support the direction of opening such services. And this project was a follow-up to the feasibility project and was initiated before, as I mentioned, the opening of the supervised consumption services at Casey House. And so the project actually had 3 quite diverse objectives. The first being to investigate how to design and deliver harm reduction services for people living with HIV in the context of COVID-19 and future emergencies. The second one being to develop an evaluation framework for proposed supervised consumption services. And the third, to identify the opportunities and challenges to fundraise for harm reduction services that aren't funded by government. So in addition to having people with lived experience of HIV and drug use on our team, we also had donors and fundraisers. And so for Objective C, these stakeholders were involved in the design of the survey that we sent out to hospital donors and the design of the interview guides, but also in the analysis teams for digging deep into that data that was collected. But today we're focusing more specifically on objectives A and B, where we interviewed people living with HIV who used drugs. We did focus groups with staff who worked at one of 3 HIV/AIDS service organizations to help us understand how to design and deliver harm reduction services and how to evaluate them. But today's conversation is not about our data, but what we want to focus on is our partnerships and how we work to embed the relevant lived experience and engage community members in all stages and components of this work. And so I'm going to turn it over to Andre, who's going to talk a bit about kind of our broader partnership and approach to engaging other organizations.
Thank you, Sue. Yeah, I think when we're thinking in the early stages of this study, we wanted to partner with folks that either have some sort of knowledge already about the object of the study, as well folks that it would eventually benefit from the results of the study, or folks that had similar mandate or doing similar work that we were doing. And I think very much the mindset that we had when we were engaging to recruit advisory committee members to join this group in terms of diversity and diversity of experiences. We want to also make sure that we have this reflected on the partner organizations as well. So we have not representation from the East, but from the rest of the country. I think there's a little bit of split. And then two community partners that we worked very, very close in Toronto. It was PAZAN and PWA. So PWA is Toronto People with the AIDS Foundation, and PAZAN stands for Prisoners. And I always get wrong this acronym, but it's an organization that works with folks that are living with HIV and have been through the legal system or incarceration. And needless to say, especially for PAZAN, but also PWA, they have a large population that will be the focus of the work that we're going to be doing. And the other partners as well, they had great knowledge, and were able to bring great contributions to the work that we're doing. So I think we could have much more partners in this study, but I think we also try to be strategic in the number of people we want to bring to the table to make sure that it's manageable and that everybody has an opportunity to contribute and share.
And then I'm going to jump in here and just explain this slide a little bit. And as Sue was saying earlier, the collaboration was with all stakeholders, and these are academic stakeholders, frontline providers, both harm reduction, social workers, and community nursing, community advocates, and healthcare administrators, as well as peers and donors. And what we noticed along it as we developed relationships and got to know each other, that people had lived and living experience in all these different areas, and we organically just used people's experience and area of interest to really focus what they could provide to the research and how they wanted to participate to the research. So I think that's the one thing I want to highlight here is a couple of the different stakeholders fit into different roles here, but organically along the way, we've used their experience and their interest to really kind of ground the work and provide some really unique perspectives.
And if I can just add really quick on this, if you have experience doing research, you might notice that it's not that easy to find or to engage folks with lived experience in all these areas of the research. So I think it was pretty amazing. Then we're lucky enough to be able to do that. And I think personally, you know, it's something the folks doing research should strive for, is to have the lived experience throughout all different areas of the research, to make sure that it's voices from the communities that are being impacted by the research throughout all the areas of the research.
Yeah, thanks so much. So this is our last slide. I'm going to take it down in one moment, but I just wanted to kind of reiterate that we, in some community engaged projects, there might be the most common a community advisory committee, and that's where people tend to kind of concentrate their lived experience. But in terms of like what we refer to as our layered approach, is that we had people with lived experience of HIV and drug use on every single of these levels. So on our leadership team, as co-investigators, as collaborators, and as I mentioned, those working groups that we had that met multiple times, that really dug deep into data that was collected for each objective. And then what we had was peer research assistants. And we actually had several of these, as Dean referred to. Like, we really tried to work with people's interests and their capacities. So while we imagined having a single peer research assistant, we had someone who had incredible skills at engaging community members and supporting them and facilitating conversations, but she wasn't interested in doing some of the other work. So we actually went with multiple peer research assistants, and then in addition to our community advisory committee. So I'm stopping our slides, and now we just have a few questions. I'm going to pose them to Dean and Andre so they can tell you a bit more about their experience in this project. And so I start by, in partnered research, we believe it's important to acknowledge and celebrate the diversity of strengths and experiences, but it's also important to acknowledge that often comes with different priorities and different reasons that people engage. And it can be easier to ignore that, but I think it's important that we acknowledge it, and that can help us build the relationships and make sure people get what they need out of it and have a meaningful interaction. So, Andre, what was your motivation for joining this project, and what would you say as your strengths that you brought to the team?
So my main motivation was that, I always been passionate about research, and I've done a lot of work in community-based research, and as part of advisory committees or the research team. But I remember when Soo approached me and had a conversation to join this team as principal investigator, which is something that I haven't done before. I was a little bit overwhelmed. It was like, I've never done that, and what that entails, and what's the commitment. And I remember Soo having a conversation with me and explaining to me and talk about, the opportunity of learning, but also not pushing me or trying to convince me to participate. Actually, if anything, she was very accommodating in the offer that she was making for me to join. Say, you take on as much as you can. If you need support, you let us know. So from the beginning, I felt the support that was coming from Soo and from Kat as well, as someone that I felt that I had lots to offer, which is the second part of the question, but also have lots to learn. And obviously I was interested in both. In terms of, I think my strengths, it was the connections that I had through my work to folks that potentially would be involved in this study, but also the skills that I bring to be able to support those attending or participating in the advisory committees or even other specific positions in the research to make sure that they feel supported, that their needs, the same way I would say that I felt when Sue was inviting me to come, what I was bringing is like replicating that, the same situation, making sure that, or trying to do my best anyways, so people who decided to join us and work with us, that they would feel valued and supported, and listened to, and also that we will work with them towards their goals as well, whatever those goals for them were.
Thanks, Andre. And so, Dean, we talked a bit about like how anxious I was about coming to ask you to join. Can you maybe share from your perspective, like what your decision-making process was and what you saw as your strengths that you brought to the team?
So I think at the first start, when I was approached, I looked at kind of where I would fit or what I was really getting involved in. And for me, I think there's different areas that my life experience is suited towards. And for me, it's always good in the sense of when I first got involved, I thought it was an opportunity to be able to share my experience, but just share knowledge as well. So just on that personal experience that we all have, and then our professional experience along the way, which kind of ties in with our life experience. So for me, I did have a connection and experience to substance use. I had, as part of my recovery and part of what I consider to be a personal harm reduction plan, is I have a community advocate type role so that I can kind of share my story with people, but also give people a place at certain tables so their voice can be heard. So it's trying to encourage other community members. So it's kind of, I've been inspired by people that have similar experience and have taken initiatives to get involved and to provide that experience. And then I'm also walking the walk in the sense of, I hope that people are inspired by me with some of the initiatives that I do. So this was a perfect opportunity. And at first, I will say I wasn't sure what my particular role was going to be, because I did have multiple roles. But I think what the strength is for me was I had done a lot of group therapy, and I have done group therapy both as a participant and as a peer facilitator with those that may be HIV positive, but also have different levels of substance use. And for me, I knew the importance of relationships, creating relationships, people being able to have safe space to share their experiences. And I think for me, I pride that because I acknowledge that and because I know that I'm very fortunate or grateful that I have the capacity to create that. So I think that I've gone on into a lot of my peer facilitation roles with that aspect of, let's first kind of create this safe space, let everyone know that they have value, let everyone know that they're an equal team member or team player. And I think organically that happened with our advisory group. We first got involved with them. And I think for me, the biggest part of it was being able to be one-on-one with that lived and living experience and to have an open mind, be very compassionate, no stigma or anything attached to the work we were doing. And then just trying people just to share not only their experiences, but their thoughts and their feelings and the way they see things. And it was just creating a very safe space. So I would say that in essence is kind of where I fit in very well. And it's also an area of interest. So that's where I'll get a lot of takeaway as well. But it's really ensuring that we had a team that could share both their experience with substance use, but also their professional experience, whatever that might be, that living experience along the way, and recognize them as kind of equal members.
Thanks, Dean. Wow, you definitely inspired me. So I think you can see that while we might have had overlapping objectives, I think that you can also see that they were quite different. So I'm going to go back to you, Andre. How about you alluded to this was your first time being on the principal investigator team. Do you want to talk a bit about maybe like what that journey and learnings were once you agreed?
Sure. Well, one thing that I learned is that it was a lot of work that I haven't done before, and I started appreciating much more folks that do that kind of work to make all happen. And I have to say and make sure that I mention Kat here, who I think not only supporting me but supporting so many other folks from the advisory committee and the peer research assistant, which had lived experience as well. I think for me, one thing that was very distinct in this experience was that I really felt valued. I really feel, and I can't speak for myself, but also based on what I've heard from other folks as well, actually from the vast majority of everybody who participated and contributed with their lived experience, that they feel that their voices were heard. There are like so many examples that I could give. We don't have enough time here to do that, where people really felt appreciated, which is really something that it doesn't happen too often. I remember in cases where I was in other research studies that I participated, then I would leave the room thinking, okay, they're not listening to what we're saying, or like we're just here as a token because they don't even give us an opportunity to talk, to voice our opinions. And I think in this study, this was something that struck us from the beginning, was that we want to make sure that people feel heard, that they were not only participating, but meaningfully participating. And I think we went like a long ways, even to provide opportunity for folks to participate at times where there's some challenges, personal challenges for them. So we're very accommodating of folks in meeting where they were at in terms of their needs as well, to be able to participate, remembering that it was a challenging time where we had to do everything virtually and through Zoom, and so some folks were not very didn't have a lot of experience with Zoom. So we had to build that capacity as well. Some others didn't have, means to access virtual virtual spaces like Zoom, for example, to contribute. So some of them participated only over the phone, or some of them, they were sharing, a phone and two participating at the same time. And we're making sure that like they had a voice, people have a voice. And even sometimes because of technical glitches, if somebody didn't have a chance to say something, after the meeting, we would go back and connect with them just to make sure that, maybe they didn't say something because they didn't have a chance to, or maybe they just didn't have something to contribute. But making sure that we knew what the case was, and if there's something that they want to contribute, they still had a chance, although they might not it might not have been possible during the meetings.
Thanks, Andre. I don't know if you were reading Isabel's mind or you saw her question come up, but maybe while Dean's answering, you could answer that, give any more detail to that in the text. So Dean, Andre kind of alluded to some of your work as the facilitator for that advisory group, but I don't know if you want to share a bit more about how you approached that work and maybe some of the surprises along the way.
I think the biggest thing and probably the most prominent thing that we discovered, and personally that I was taken back, is that I was surprised that the research really changed along the way. And that was totally based on the feedback we got from the advisory lived and live experience people. And those first couple of meetings really set the tone for what they felt was important and how they seen some of the requirements of what a safe consumption site might look like, or what that research might look like. And for me, I have done other initiatives in this area, and I'm an advocate for that lived and living experience to be at the table and to be recognized in different ways. So part of that recognition is compensation or an honorarium. So one of the things in what we were doing is, at that very first meeting, we shared with people who I would consider peers, and they were talking about, we were doing the administration and telling them about their participation and being able to acknowledge their participation with an honorarium, and gave them kind of what our honorarium would be for the research. And within the work that I do in the community in the downtown area, the original honorarium was quite similar to what I see in a lot of my other work. And when the peer advisors started to talk about not only being kind of valued as an equal team member, but having their experience and time valued, but also letting us know that they were sharing vulnerable experiences and thoughts for them. And they thought that required additional kind of recognition. And for me, being a peer at this level, at first I thought that might be an over ask, because here we are, we're kind of doing things within the box, which within the norm of other community initiatives. But then I did have to stop and think and take that feedback in and look at recognizing that they were sharing their time, they were sharing their experiences, and they were sharing vulnerabilities. And as well, for them to do that, we all felt that they would need to be recognized in a different way. So within the research grant and within the research team, we explored that, and the requests made by the advisory council, we were able to meet what they thought was fair, which was substantially more than kind of what we originally intended. And then I think the other thing that is really instrumental along the way is that in community work, we always tend to be very focused at different initiatives and at the way we approach both research and maybe healthcare programs and services. But what I've seen within the advisory group, that the feedback they provided really set the tone and changed the direction of our research, so that by the feedback that we provided and that lived and living experience provided, it molded kind of where the research went, how the research kind of developed, and that end goal. So for me, as kind of like a peer, being able to facilitate those meetings, I felt that we were able to provide this really safe space where people could share their vulnerabilities and share their voices. As well, they were really provided kind of the opportunity to feel equal in our work. And I think that along the way we could show that their feedback was tremendously important. It shaped the work. It's where we went. So I think at the end, we're also able to demonstrate and example their words in the different parts of the work and their thoughts in how it was presented. So for me, that's probably the most kind of instrumental. And it's the creation of safe space. It's including everyone with kind of an equal value and making them feel that way, that they have equal value. And then realizing that while it's really good to have a plan, we need to recognize that a plan will change based on the input and feedback we get along the way. And I thought that this research project really demonstrated that.
Thanks so much, Dean. So I realize we ran right to 1 o'clock. I'm going to turn it over to Maureen to close in like a minute, but we're going to, for those who want to stay on for reflecting together, please do. I'm happy to kind of take any questions there.
Thank you. Thank you, Sue, Dean, and Andre. We do have one question in the chat, but for sake of time, I'm going to move on and just thank all of you so much for such an insightful conversation. We've learned so much about how to do community engagement and the power of community engagement and the important things to consider when we are engaging in public partners as research partners, and the importance of valuing their contributions in different ways, and to do that in a way that acknowledges their lived experience and is honoring of all of the time and expertise and experience that they bring to the table, and the fact that it's important to consider those things when we are involving the public in research, is thinking about their experience and how can you best leverage their experience, their expertise, their capacities to truly enrich the program. So I really appreciate your governance structure and how you strategically engaged the public in people with lived experience in your research, and how impactful that was. And as you said, Dean, how it changed the course of the research and the real impact that they had on, as a result of sharing their time. As you said, they're sharing their time, their experience, and their vulnerabilities. So really appreciate your time today. And I would also like to just remind you that we're going to be moving on now to the reflective session. So if you're interested in staying, if you could just continue to stay on this Zoom call, and I'd like to welcome our collaborative member, Tina Falco, and also reintroduce Soo Chan Carusone to lead this discussion. And I just wanted to remind you of our next collaborative conversation that will be coming on September the 28th. So please stay posted for more information on that, and we hope that you'll all join us for that event. So thank you all very, very much, and I hope that you will stay on and join us for the next part of this conversation, and have a wonderful afternoon.